Hello all. So today we are going to discuss about one of the best-selling product of Aakaar, which most of the people in aesthetic market or most of the dermatologists will be very aware about. That is Blackpeel Exoresurfacing, which is a wonderful product for the treatment of all the type of acne. So this particular product is highly famous in the among the dermats or in the aesthetic market because this has been used by lot of doctors for the treatment of high severity of acne. So let's discuss what is there in black pea. What is so special about that product? It can cure any kind of acne marks or acne on face. Blackpeel exoresurfacing. Indication itself is grade 1 to 4 acne management. From that word itself, it's very clear that from the smallest range, when a people have minute acne to the high grade of acne, this particular product can treat. And the sessions will be highly depending about from what the dermats would prescribe you, or minimum 4 to 5 sessions are required, and it depends on the severity of the acne majorly. So let's understand what is it that actually causing this acne to appear on your skin. So already in one of our previous sessions among the tubelite range also I've discussed about acne a lot. So still we'll again revise through it so that it will be more clear. So acne is a very common skin condition. We know that this skin condition causes pimples, acne on face. And this particular thing will consist of blackheads, whiteheads, other types of pimples also on the skin. So there are different types of acne which can appear on the skin. So it's a very common skin condition. The most common spots for the breakout, the most common spots where this acne can appear is majorly face, then it can come on the chest, then it comes on the shoulders, then again on the back of the body. So these are all the common spots. We need to understand what are the different types of acne. So there are non-inflammatory acne, there is inflammatory acne. So non-inflammatory acne are those which they are mainly the blackheads and whiteheads which commonly we see on people's face. These normally don't cause swelling. So which are non-inflammatory from the word itself, which does not cause swelling, that are called as the non-inflammatory acne, which mainly includes blackheads and whiteheads. But in the case of inflammatory acne, those pimples or acne are very red and they're swollen. So that's why it is known as inflammatory, red and swollen it would be. So we can identify that they are having, a particular person is having an inflammatory acne. Under inflammatory acne, we have got papules, then we have got pustules, then we have nodules and cysts. So these are the different kinds of inflammatory acne which is coming. Now let's understand in detail about the blackheads and whiteheads and also about the different types of inflammatory acne. So blackheads are the comedones that are open. So the blackheads are the acne which are open at the surface of the skin. They are filled with excess oil and dead skin cells. When your skin is getting filled with when your sebaceous hair follicles on the skin, or when your skin is getting filled with such oil, dirt, and impurities and dead skin cells, we usually get acne. So we have already spoken about the mechanism of acne generation also in our lot of previous sessions. So blackheads are those comedones which are open at the surface of skin, but this still contains dirt, oil, and impurities. Whiteheads are the comedones that stay closed at the surface of the skin. So this happens when oil and dead skin cells prevent a clogged hair follicle from opening. So it is always closed. It does not help the pores to open over there. Those are whiteheads. So now we have been repeatedly mentioning about the word called comedone. So we need to understand what is a comedone. So a comedone or a basic acne lesion is a hair follicle that has become clogged with oil and dead skin cells. So comedones are basically those hair follicles, sebaceous hair follicles on your skin that become clogged with hair, dead skin cells, impurities. So these comedones are the plural form of comedone, and it develop into bumps called whiteheads and blackheads. So these comedones are basically the hair follicles clogged with oil, dead skin cells, impurities, and they developed into blackheads and the whiteheads. So blackheads are basically open at the surface of skin and whiteheads are basically closed at the surface of the skin. Now let's understand the different types of inflammatory acne. So inflammatory acne, we have already spoken that they are very red and swollen. So under that, we have got different types. We have got papules, then we have pustules, then we have nodules, then we have cysts. So papules occur when the wall surrounding the pores of acne break down from severe inflammation. So papules are coming from where when the wall surrounding such acne, the wall surrounding such pores are breaking down from severe inflammation. This results in hard clogged pores which are very tender to touch. So usually the skin around this pores will be usually, we can say, very reddish or pinkish in color. So those are papules. So from the picture, you can clearly see those are very red and pink in color. This is because the walls surrounding such pores or acne are breaking down from severe inflammation. So next is pustules. Pustules also form when the walls around your pores break down. So unlike papules, pustules are filled with pus. When you see pus over the skin, you should understand it's an inflammatory acne and it's a pustule. Nodules occur when the clogged swollen pores enter further irritation and grow larger in size. Nodules also, which we can mostly see on people's face, swollen pores enter further irritation, they're growing larger in size. So unlike pustules and papules, nodules are deeper underneath the skin. Then cyst. Cyst can develop when pores are clogged by a combination of bacteria, sebum, dead skin. These are clogged by all these kind of bacteria and sebum and dead skin cells. There are cysts. So here you can clearly see the different types of inflammatory acne, and this is very common on people's face. So now we will understand what is our this innovative product. So Aakaar proudly offers the world's or India's best exosome-based innovative range, that is the Blackpeel Exoresurfacing, #1 patented, original, natural. It's trusted by more than 2,700 plus doctors. Most of the dermats are aware of this wonderful product, that is Blackpeel Exoresurfacing. It's a 10 ml product. It can cure from grade 1 acne to grade 4 acne management. And this is made in Korea. It's a theraderm product, which is marketed by Aakaar. So it's an exosome powered organic peel. It does not have any chemical in that. It's an organic peel. So there is no irritation happening. So exosome powered organic peel, which can treat grade 1 to 4 acne management. The exosome based innovative range Blackpeel Exo Resurfacing. Now let's understand what are the major ingredients present in the black peel. First, we have got black exothera. Exosomes are there, and we have taken these exosomes from the black rice. So this is majorly for anti-inflammatory and aquaporin stimulation, majorly to prevent the inflammatory happening. Black sebothera from black acetic acid and niacinamide, keratolytic, comedolytic, wound healing, and cell proliferation. So this has an important function of wound healing as well. Salicylic acid and betaine salicylate for keratolytic and sebum reduction. So sebum has to be reduced because of the excess sebum production, acne keeps on coming on the face. So for that blackhead reduction, for sebum reduction, we have salicylic and betaine salicylate. Lactic acid, acne scar prevention. Definitely when acne comes, there will be a lot of scars or marks left behind. So to prevent that, we have got lactic acid. Then we have got citric acid for exfoliating and for the even skin tone. So to have a brighter skin, we have citric acid, potassium iodide, antifungal, and faster wound recovery. So for having a immediate wound recovery, faster one, we have potassium iodide, biosulfur, antibacterial and antimicrobial, butylene glycol, skin softening, and hydration. So all these have got the wonderful important properties or benefits which we require. So there are a lot of ingredients for wound healing. It's for blackhead sebum reduction. There is for acne scar prevention, for getting a brighter even skin tone, faster wound recovery, antibacterial and antimicrobial, and skin softening and even hydration too is being provided by our Blackpeel Exo Resurfacing. Now let's understand in detail. So first ingredient which we have said is black exothera, which we said is being taken from black rice. So exosomes are being taken from this such black rice. So exosomes are basically the powerful extracellular nanovesicle, which are very good communication engines. So it contains proteins, lipids, mRNA, DNA, and it ranges between a size of 20 to 150 nanometer, which is very small in size. It is enclosed in a lipid bilayer structure. But these are now the new stars of the emerging derma industry. They are the powerful emerging stars. So exosomes are being now added in a lot of products for getting best collagen production, skin cell regeneration, because it contains a lot of proteins, lipids, deoxyribonucleic acids, mRNA. So there are a lot of things, even though it's very smaller in size. So peeling promotes the penetration of exosomes. It's an organic peel. Our black peel is an organic peel. So it is helping the penetration of exosome maximum as a delivery vehicle. So when you apply black peel on the face for your treatment of acne, there is penetration of exosomes happening. So the organic peel or this peeling is allowing the faster and the wide penetration of exosome, which are taken from the black rice, which is in our product. So through intercellular lipid layers, because they are enclosed in a lipid bilayer, these exosomes. So the exosome exert all cytotoxic activity deep into skin. So when you are using black peel, the exosomes from black rice is maximum penetrating towards your skin, and it is moving more faster into deep into the skin. So next, we have got salicylic acid and lactic acid. So salicylic acid is for the keratolytic and sebum reduction. So it decreases majorly the sebum secretion. It softens and exfoliates stratum corneum, keratolytic and comedolytic. So basically for the sebum reduction and for softening our layers of skin, we have got salicylic acid. Then lactic acid is majorly for the acne scar prevention, prevents the superficial acne scarring, improves the skin texture, reduces pigmentation and the appearance of pores happening. Then we have got betaine salicylate for reducing the blackheads, which is a non-inflammatory acne by preventing the clogged pores, which because we have said they're majorly present on the surface of the skin, they're open over there, so they prevent the clogged pores and reduce blackheads. They improve the skin thickness and collagen production, break down the keratin and sebum in the skin pores. Then we have got citric acid for giving an even skin tone. So it increases the viable epidermal thickness, smoothens the stratum corneum, helps remove the dead skin cells and promotes even skin tone. So we could see the wide range of properties are provided from the various key ingredients present in our black peel. Then we have got potassium iodide for the faster wound recovery, that is used for deep fungal infection, severe induced wound. So it ensures faster recovery in acute chronic wounds, combat infections, and reduces the bacterial count, reduce microbial load to modulate host cells to elicit, respond, and stimulate healing. Then we have got butylene glycol for hydration, skin softening. So basically it hydrates the skin, it prevents the water loss by creating the barrier, it treats the symptoms in acne prone skin being antimicrobial. Then we have got biosulfur, powerful antifungal and active antibacterial, inhibit the growth of P. acne, P, propionibacterium acnes. We have already discussed about this before in the mechanism of acne generation in the previous sessions too. So it is inhibiting the growth of such propionibacteriums. It prevents the water loss by creating the barrier. It treats the symptoms in acne prone skin being antimicrobial. It is preventing infections happening. So all the key ingredients here is making sure that your acne problem get cured, your skin gets even skin tone, your skin gets a faster wound recovery, your skin gets into healing in a very fast mode. There's no scars prevent you. Your skin gets ultimate skin hydration. So all the key ingredients are focusing towards that. Now, we should understand the clinical protocol. It's a very simple clinical protocol with a very fast maximum results. So first step, always before doing any of the treatment, any of the peeling treatment, any of medifacial treatment, even we have discussed in the previous session, first cleansing your skin is very, very important. So first step is cleanse your skin with Tubelite Acne Cleanse, which we have already spoken as a customized cleanser for acne. Then extract the comedones using a comedone extractor. Usually dermats do that. Then the third step is a very important. You have to take 1 ml, just 1 ml of black peel exoresurfacing solution from the bottle into the insulin or a normal syringe. You can pour the black peel exo directly to the face from the T-zone, O-zone, and U-zone, basically the forehead, neck, cheek side, and wait for just 3 minutes and then wash the face with cold water. So just take out 1 ml, pour, taking into a normal syringe, pour directly on the acne. Majorly it happens. Majorly acne comes over where in the face, over the forehead or in the cheeks part or in the neck part. All these are the places where usually chin part where you see acne. So you can pour directly over 1 ml of black peel exo directly over there, drop by drop, and just wait for maximum 3 minutes and wash it off with cold water. Then the post care, what you have to do, which is very, very important after doing black peel, is that you have to use a moisturizer and a very good sunscreen. So we have our own Tube Light Acne Hydrate customized moisturizer for acne, and Tube Light Acne Skin customized sunscreen for acne regularly every 2 to 3 hours after the treatment before you step out. Because any medifacial or any organic peel or any treatment you do, you have to always protect your skin once the treatment is done on the face. So this is the clinical protocol, which is a 3-minute challenge for acne free skin. So this is the clinical protocol for our black peel exo. We have already said about our product is the #1 patented original natural, trusted by 2,700 plus doctors, 8 years of trust, 2,700 plus, more than that a lot. We have got dermats using it. 2 lakh plus treatments have been done, officially, if clinically proven and efficacy and safety, powered with exosome. We have said we have got black rice exosome for the maximum penetration to the skin. Easy protocol of just 3 minutes challenge, consistent result, high patient compliance and satisfaction. So this is our wonderful exosome powered organic peel, black peel exo resurfacing, which is just a 10 ml bottle, but which can cure all the type of acne from grade 1 to 4 acne management, which is a completely organic peel, which is used by most of the dermats all over, which is a wonderful product. So we can clearly see some of the before after images of the patients from high severity. If you see the first picture, she has got huge inflammatory acne over her face. So from that forehead part where she had got the such inflammatory acne, she has gone to a very clear skin. You can clearly see the difference of the magic of black peel exo resurfacing. If you see the second picture also, we can see over the nose he have got huge inflammatory acne. From there he has gone to a very less acne. Matlab, it has become zero totally. So such a wonderful product which can give such a super fast result. So use of black peel. Black makes everyone really beautiful. So that's all about black peel exo resurfacing. Thank you.